All right, so here we're going to get into principles of electric modality. So looking at electrical stimulation as a therapeutic agent to treat issues with musculoskeletal injury, we first have to look at and kind of have a basic understanding as to how electricity works and kind of understand some basic concepts. And some of this will be more readily applicable to what we do clinically with the electrical modalities, but you still have to have basic knowledge of some electric principles. Some things, so not everything's necessarily going to be a setting or something that you have to worry about per se as far as a treatment parameter, but just kind of understanding the basics of electricity. Okay, so looking at some basics involved with electricity. So just some standard definitions. So an ampere is just a measure of the electrical current, and what this does is looks at the rate of electron flow. So when electrons are moving, when you have a current, electrons possess a negative charge, and they flow from an area of negative charge to positive charge. So that's the ampere. The charge itself is measured in what's called a coulomb, okay, and that's the amount of electricity delivered. So the overall amount of electricity delivered with therapeutic current is obviously very small. It's in the micro and millivolt range, but that's how the actual measurement or how the electrical current kind of gets quantified. Voltage is a measurement of the force, or as your textbook calls it, the electromotive force, and this is kind of dictated based upon the electrical potential difference. So there has to be a difference between the positive and negative poles that we're looking at. The electrical stimulator has to also, that you're using for treatment purposes, has to have enough voltage to overcome resistance in the tissue. Okay, so there'll be resistance in the tissue. The electrical stimulator that you're using has to be able to overcome that. That takes us to resistance, which is the opposition to the flow of electrons. So we look at the conducting material, and this measurement is measured in a unit called the ohm, OHMS, or OHM. When the driving force is present, so when you have voltage, the amount of resistance determines the current flow. So how much resistance there is, and that's going to be based on what type of conducting material you have to conduct electricity, will kind of dictate that opposition. And then the last one is impedance. So this is going to be the sum of what we have with resistance, what we call with inductance and capacitance. Okay, so resistance looks at the opposition based upon the substance that the electrical current is passing through. And again, this probably has the greatest the resistance probably has the greatest influence on stim application, so you need voltage in order for the current to pass through. But the concept of impedance looks at those other factors, also looks at resistance, inductance, and capacitance. If you remember going back to the discussion on diathermy, so inductance, you have opposition through what's called an eddy current. So that creates an effect as well when you're looking at the electrical stimulation. So if we kind of look at all of this, and again, so just kind of be aware of the basic definitions here for testing purposes. But if we were to look at this in a practical sense, and I think this is your textbook, I think, gives this example. Think of the voltage, think of they use a water flow analogy, okay? So the voltage is the water pump that's going to kind of help pump the water through. The ampere is like a measurement, so it's like think of that as being like a gallon of water, and then the ohm would be the length and distance of the pipe that the water is going through. So if you kind of think about it from that perspective, it kind of gives you a little idea as to how you can apply this when you're looking at how energy will kind of pass through an electrical current. So if you look here, when you apply electrical stim to the patient, okay, the patient's body becomes part of the circuit. So the stimulator has to produce voltage because you have to overcome the resistance of the wires and the tissue. So in order for the electrical current to go through, it has to have that force to, one, be able to go through the wires, and then once it goes through the wires to the electrode pads, it then has to overcome what's in the body. And the current is going to look to pass along the path of least resistance. So the greatest resistance is going to be in the skin. The least resistance would be in something like the nerves. The nerves can conduct electricity very good. So if you just look at here, you kind of see in general how even just looking at how a sensation, and you'll see how this applies later with electrical stim. So here they're just kind of showing you just basic sensory input and kind of how the central nervous system responds. So you have a stimulus to the skin is received by a sensory receptor. So in this case, they're just kind of showing a pin kind of hitting the skin. The sensory receptor takes it to the neuron. The action potential travels through the sensory neurons to the CNS. The CNS interprets the information and determines a motor response or reflexively initiates the appropriate motor response. It then comes out through a motor neuron, and then you get an action potential. So you'd have the same idea going on when you apply electrical stim. We're looking to, and with electrical stim, in general, you're typically looking to do one of two things. You're either looking to promote some sort of sensory effect, or you look to produce a motor effect through the type of stim you're using. And again, you just would manipulate that through some of the parameters that you'd be setting with it. Okay, looking at electrical currents. So again, Ohm's law. So when we look at that, again, the resistance is going to be measured in ohms, and that's going to be the equation that we have up there. Voltage is equal to current times resistance. So as the resistance increases, you need more voltage. Okay, so when you're looking at that, the relationship there, and then the types of currents that you have with electricity, you have alternating current, you have direct current, you have monophasic, where you can have uniquely positive or negative electrodes. So there are some forms of electrical stim where you will do what's called a monophasic current, and that will get you the effects from a uniquely positive or negative charge. And then you have biphasic, where there's a constant shift in polarity. So when we're looking at this with AC and DC, there's no interruption. So an alternating current and in a direct current, there are no interruptions in it. So in other words, they just keep on flowing. Typically, what we're going to be utilizing for the purposes of therapy is what's called a pulsatile current. So a pulsatile current is safer because what it does is it has phase durations and interpulse intervals. So in other words, the electricity isn't on all the time. So that tends to be safer. And what you will actually do with the pulsatile current is that you'll control the number of pulses per second, or the frequency of the current, and that will impact what type of treatment effects that you get from the electrical stim. Okay, so this illustration is, we kind of go through a lot of the discussion here. You're going to be seeing a lot of pictures like this, so just to orientate yourself to it. So, you know, when we're looking at this, so first of all, this represents an alternating current, and that's because it alternates between the positive and negative poles. So this represents the positive, this represents the negative, and this is what we call the zero line or the isoelectric line. So what we're using this picture to kind of demonstrate is what we call the inverse relationship between what's called phase duration and pulse frequency. Okay, so there's an inverse relationship between those two things. So the phase duration, okay, the phase duration is when the current leaves the isoelectric line, so right here, kind of comes up and returns to the isoelectric line. So this right here would be a phase duration. You can make the phase duration longer, this would make this bigger, or you can make it shorter and it would be more narrow. A pulse is basically a movement of a charged particle. So with a pulse, now we're going to go from here all the way around and in there. So this represents a pulse. Okay, so as we said, there's an inverse relationship between the phase duration and pulse frequency. So say we were just looking at frequency represents the number of pulses per second. So let's just say we're going to cut it off here, that was representative of the frequency of this current. Well, you would have 2 pulses per second because you would have 1, 2. The reason why you have an inverse relationship is as the phase duration gets bigger, you're going to have fewer pulses because the phases, okay, this is a phase down here as well, the phases are going to get wider, so you won't have as many pulses per second. If the phase duration was shorter, meaning that this was more narrow, you'd have room for more pulses. okay? So there's an inverse relationship, and that's important because phase duration and pulse frequency will be some of the parameters that you can change with some of your electrical stim waveforms. So the previous current was what we call an alternating current. So some other descriptors of that current would be what's called sinusoidal. That's the shape of the current. And it's also biphasic because it is two phases. What we're looking at here is what's called the direct current. So a direct current, which would also be monophasic because it only has one phase. So if you look here, again, if we're saying this is positive, this is negative, it's only in the positive. And anytime you get a continuous flow of current in one direction greater than a second, that's considered a direct current. So the most common form of direct current that you're going to be using clinically is what's called iontophoresis. That's actually a form of electrical stim that actually assists with taking a medication through the skin. So there's anti-inflammatory and pain-relieving medications that you can apply to special electrodes, and then you can drive that current or get that medicine to kind of flow through the skin and get absorbed in the tissue through the use of an electrical current. So in this picture, we start to look at some other characteristics. So again, as I said previously, the most common currents and waveforms that you're going to be using in rehabilitation are what are called pulsatile currents. So pulsatile currents, basically, if you looked at that alternating current that we looked at earlier, pulsatile current kind of takes that and puts interrupted pulses in there. And then through the idea of modulation, you could actually modulate the waveform and create different characteristics of the actual stim. So a lot of the types of stim, there's going to be various shapes of the currents, there's going to be various phase duration and various interpulse intervals, okay? The natural interpulse interval, which we're showing here, is what allows a clinician to control the frequency and the phase duration. So again, part of knowing this and understanding this is what types of parameters you can adjust, and even more specifically with the waveform, how can you adjust them? So pretty much all your waveforms for the most part are going to allow you to adjust frequency or how many pulses per second. That's going to dictate what type of physical response the person is going to have from the stim. And some versions of stim will allow you to change the phase duration, meaning that widening or narrowing of the actual pulse, okay? But with the natural interpulse interval that you have, that's going to allow you to modulate the actual waveform, and that's primarily what you're looking at as far as the electrical stim that you use clinically. So here's another picture kind of showing some different characteristics here. So if you look, you have again, showing you the phase duration and the interpulse interval. So here, if you were just looking at this, so now we're only looking at one phase. Now it's not a direct current because it's interrupted. You have a natural interpulse interval. So this would be considered a monophasic current, okay, because it is interrupted. So it is pulsatile, okay, because you have an interpulse interval. Here they're showing you the phase duration. So again, this is representative of a phase. If this was wider, your frequency would go down, okay? If it was narrow, this is they're representing it pretty narrow. That's why you have this. So say again, if just for simplicity's sake, we're saying this is representative of a second, and this was 1, 2, 3, 4, 5, 6 pulses per second. Say we increase the phase duration, that might turn that frequency down to 3 pulses per second because you'd only be able to fit so many pulses within the actual frequency if you were to increase the phase duration. So now here we have a pulsatile biphasic current, okay? So, and the reason why it's a pulsatile biphasic current is that it flows in more than one direction, so it's biphasic, okay? It's pulsatile, we have interpulse intervals, it is 2 phases per pulse, so that's why it's biphasic. So 1, 2, okay? There's an interpulse interval, all right? And in this case, when you're looking at the electrodes, because the electricity flows in one direction and the other, neither electrode is exclusively positive or negative, okay, because you have that. So when you're talking a lot of your biphasic treatments, you don't necessarily have to worry about a positive or a negative electrode, okay? There will be some treatments where you place the positive and negative electrode matters. In the case of this, it wouldn't matter. And again, the interruptions that you have in the pulses that you see, these little interpulse intervals, I'll show you here, these right in here, so these little interruptions, that's what allows you to independently change the pulse duration and the frequency, okay, or the phase duration and the frequency. That's what allows you to change that. So this would, again, would be a biphasic pulsed current. So parameters of electrical stimulation. So first you have to look at, are you going to get a physiochemical effect, okay, where you get an ionizing effect, and you would have this with when you're talking about galvanic stimulation, where you actually get a pH change in the tissue. Most of the forms of electrical stim that we utilize do not promote this. Most of them that we're going to use in class do not promote an ionizing effect or galvanic stim. Therefore, you know, with the forms that we use, you typically don't have to worry about things like skin burn. So one of the things with galvanic stimulation you have to worry about, because it changes the pH in tissue, is that you could possibly get a little burn from it. The physiologic effect looks at the depolarization of the nerve, and that produces an action potential. So, and what we're looking at there is, with a lot of our forms, either looking to get a sensory effect or a motor effect from the stim. Okay? And then we have the characteristics of the electrical current. So the characteristics of the electrical current, there are 5 things that we're all going to be talking about. You have the amplitude, the phase duration, the frequency, the rise time, and the duty cycle. So those 5 characteristics of the stim, and again, some of those things you'll be able to directly adjust depending upon the waveform that you're using. There's multiple waveforms, and many of them accomplish, you know, similar effects. You know, we'll talk about in class why you would choose one over the other potentially and apply that clinically. But those characteristics are going to be things that kind of tell you what type of effect you're going to be getting from the currents that you're utilizing. So looking at these characteristics, the first one that we're going to look at is amplitude. Amplitude represents the intensity of the actual current. So intensity is actually one of the things you'll be setting on the electrical stimulation that you'll be using. Some other things to kind of consider when you're looking at this. So the peak current represents the maximal amplitude that you're looking at. And the idea here is that you must exceed the threshold of the nerve or muscle, okay? So when you're looking at physiologically, large diameter sensory and motor nerves tend to have low thresholds. In other words, smaller intensities of electrical current are needed in order to get an action potential. You have to remember too, from a sensory perspective, the A beta fibers, which are your sensory receptors, are closer to the skin. So to stimulate it, once you turn up as you're turning up the electrical stimulation, a sensory sensation will always precede a motor response, okay? So even when you're trying to get a motor response, you'll initially have a sensory response or the little pins and needles feeling prior to an actual motor response occurring, even if you're trying to elicit a muscular contraction. So with most of your forms of stim, you're either looking to just activate a sensory nerve, in the case of an A beta fiber, to do level 1 pain control, or you're looking to do motor stim either to work on another type of pain control or to actually produce a strengthening effect in the muscle. The average current just also takes into consideration the peak amplitude and the phase duration. So if you look here, they're kind of illustrating with different shapes and peaks what the average current of those individual waveforms would be. Okay, so you have the peak current, you have the average current. Another thing that you have to take into consideration is the phase charge. So particularly pH changes that occur under electrodes. Really the only type of stim you'd have to be worried about that we're talking about with pH changes or with ionophoresis. It is also possible to have a high peak but low average power with high volt. So you see that with the little sawtooth. This is typically what high volt looks like, although it would look a little different because usually you have more than one pulse. But you can also, so that could have a really high peak but a low average current because of the way the current actually flows when you're looking at high volt electricity. Phase duration. Okay, so again, here we're looking at, so again, we talked about phase duration already. It's the duration of the individual phase of a current, time it takes to leave the isoelectric line and return to it. So if it's, and again, if you have a biphasic pulse where you have two phase durations for each pulse, or you could have monophasic where the phase and pulse duration are going to be the same. Okay, so if you look over here, so this would be a monophasic, okay, waveform here, because you're not going below, you're not going into the negative with this. So in that case, the phase and the pulse duration are the same. In the case over here, okay, this is your phase duration. Your pulse duration would actually be this, because you have to consider the duration of the whole pulse, okay? And pretty much once you change one, so on some machines for some waveforms, they may call it pulse duration or phase duration. Either way, you're just changing the width of these different phases, okay? Your frequency, again, would be taking into consideration the entire unit as well, okay? The length of the phase duration has to overcome the capacitance of the targeted nerve to cause an action potential, okay? So that's going to be important. So again, that's going to play a role with what actually happens. The strength duration looks at both amplitude and duration are linked in the phase charge. So when you're looking at the effect you're going to get, you have to look at both the amplitude and the phase duration to get what type of effect that you're going to get in the actual tissue. So for instance, when we actually start to utilize the electrical stim, in the case where you can adjust the phase duration, so note the intensity needed to get a sensory response at a shorter phase duration, something like 50 microseconds, and then increase the phase duration, and note that you won't have to go as far in order to get a motor response. Okay, so as you're increasing the phase duration, which you normally do in order to get a motor response, the amplitude doesn't have to be nearly as high, whereas the intensity to get a sensory response, it changes when you start to shorten the phase duration. So this illustration showing what I just talked about. So you have the nerve response or the action potential. So if you notice the amplitude and the phase duration. So over here, this is representative of amplitude. This is representative of phase duration. Here we're looking at the nerve response. So when you have a short phase duration, you need a higher amplitude to hit the threshold of the nerve, whereas when the phase duration is longer, the intensity doesn't have to be quite as high in order to kind of hit that. And that's part of the reason why when you're looking to get a motor response, you're going to have a longer phase duration. In order to do that, that's going to lower the amount of intensity or the amplitude that you're going to have to provide when doing the electrical stim. Again, this is just showing the different types of nerve fibers and how they get stimulated. So if you notice looking at the chart, the A beta fibers, that's what you're looking at right here. This is representative of A beta fibers. So A beta are stimulated by a shorter phase duration. Your A delta and C need a longer phase duration. So your phase duration increases the more in order to get to those other fibers. So if you think about how we control pain, so go back to your information on pain control, we stimulate the A delta and C fibers with different types of phase durations to control pain through those levels of pain control, as opposed to the A beta fiber. Okay, so those fibers require a longer phase duration as opposed to the A beta fibers, which requires a short phase duration. So when you're doing level 1 pain control, And stimulating the A beta fibers, you're actually going to utilize a shorter phase duration.